it after the formal bit.
Good morning, everybody, councillors and any members of the public who are watching. My name is Simon Jones. I'd just like to welcome you to the Health and Adult Social Care Overview and Scrutiny Committee. Now, the video and audio content of this meeting is being live streamed and recorded. And if any member of the public present has any concerns about this, please let us know. Please will all presenters speak loudly and clearly. Would you all please ensure that your mobiles are set to silent? First item on the agenda is apologies. There are none. Public questions. Oh no, minutes. Item 2, minutes, page 128, to confirm the minutes of the meetings held on the 19th of April 2021 and the 20th of May 2021. Attached. Are we happy that they're true and correct copy of the minutes? Yeah.
Yes. Joe, thank you. Confirm.
Confirmed, right? Yeah.
Councillor Halliday, I'll second that.
Thank you, Councillor Halliday. So those minutes are accepted. Oh dear. Excuse me a minute, technical issues. I've got the pop up on my screen, so I can't see the questions. Okay. Moving to item 4, which is public question time. There are none. Item 5, members' questions. There are none. So we'll move straight on now to item 6, membership of the Joint Health Overview and Scrutiny Committee. Election of elected members and appointment of co-option members to the Joint Health and Overview Scrutiny Committee. The report. Yeah, would you like to present the report, Daniel?
One of the responsibilities that this committee has is to elect 6 members to the Joint Health Overview and Scrutiny Committee. The rules are as follows. 3 of those members need to be elected members of the council, councillors as it were, and 3 of them are co-opted independent members, so they cannot be councillors. The rules also state that our appointments have to be politically balanced within the local authority. So for the purposes of that, our default position is that we need to elect 2 Conservative group members and 1 Liberal Democrat group member to the Joint Health Overview and Scrutiny Committee. Any amends to that are at the initial discretion of the chair, but ultimately it is for you to agree the proposals put before you. To save going through sort of nominations, seconding and elections, what we propose to do in the first instance is for the chair to propose 3 names for elected members and 3 names for co-opted members. If the committee agrees those names, then we'll continue. If not, then we'll have any proposals that come from the floor and we'll work those through as and when we get them. So it's over to you, Chair.
Yes, thank you. So from the chair, as my predecessor previously did, she actually gifted one of the Conservative seats to one of the other non-Conservative members, and I intend to do the same. So my proposition for the 3 elected members are Heather Kidd as the Liberal Democrat, Kate Halliday as the gifted Conservative seat, and myself, Simon Jones, as the chair of the committee. And then we've had 3 applications so far for the position of co-opted members. So I'd like to propose those en bloc as well, which is Ian Hume, David Beachy and Karen Colbert. So I make that as my proposition. Is that seconded?
Second that, Chair.
Thank you, Councillor Minnery. So are there any other nominations? So all in favour? Thank you very much for that. Okay. So The agenda's gone again off my screen. Okay, so we now move to item 7 on the agenda, which is an introduction from the Executive Director of Adult Services, Tanya.
Good morning, committee, and very warm welcome. Can you hear me okay at the back there, Amanda? Is my voice loud enough?
A little more congestion would be welcome.
Okay, thank you very much. So Daniel's going to be my assistant. So thank you, Daniel. Next slide, please. So I'm going to lay out just 9 slides, not death by PowerPoint, just 9 slides, just going through some of the key priorities in adult social care, public health and housing over the next kind of 2 years. So establishing a strong evidence base for local decision making to have one source of understanding of our people, communities and place through the JSNA. So at DPH, Rachel Robinson provides an overview to our last HOSC on the JSNA, but a quick summary for committee today. It's a responsibility for the Health and Wellbeing Board to deliver a JSNA. In May 21, we have moved to a place-based approach. 18 needs assessments will be provided across Shropshire, including health and care, demography and wider determinants of health services. We will engage with communities to understand what matters to them most. It's a really ambitious programme to understand, engage with communities as the evidence base for commissioning grants, services moving forward. We will need to have really strong member engagement, really crucial with all our stakeholders. This is looking at a 2-year plus programme to deliver. Focus on place, community at the heart of Shropshire, building up communities and recognising communities that have a VSC and partners working together. In this area, as a mechanism to tackle inequalities, focus on prevention and early intervention, reducing demand for specialist services whilst improving outcomes and quality of life. Building on current best practice around social prescribing and community, voluntary sector and engagement. A key part of this is developing our offer to children and young people in terms of social prescribing.
Sorry, Tanya, can I just interrupt a second? I've had a query about some of the abbreviations. JSNA, which obviously is
Joint Strategic Needs Assessment, I do apologise.
And PHM,
Public Health and Management.
Lovely. Okay, thank you. If you could.
Yes, thank you very much for my comment for that to me. So Health in All, embedding this approach across the council and health and care system and transforming the local public health and regulatory services structures to respond to the public health challenges of living with COVID, post COVID and the response phase, including building a sustainable health protection system to meet our new responsibilities. Developing system-wide health improvement programmes to tackle unhealthy lifestyles. This includes weight management, smoking and alcohol, and how this can be supported through social prescribing. Building systems to promote good mental health and well-being, giving mental and physical health parity. Next slide, please, Daniel. So for many years, there's been an imperative from government towards closer integrated working between adult social care and the NHS. There is currently a white paper, Integrating Care, which intends to put these arrangements on a legal footing with the creation of an integrated care system. The intention is closer collaboration between all these agencies to deliver better joined up outcomes for people. This is a really busy slide, I recognise that. So being front and centre of the emerging integrated care systems with the NHS is developing local place-based partnerships to lead that delivery through the Shropshire Integrated Place Partnership. This partnership has now met twice and there's a workshop planned later this month to agree focused programmes of work. These are likely to include Healthy Lives. Members will remember the Care Closer to Home programme, which the CCG led on. So we will continue to work with that in terms of frailty at the front door, case management approach, home first model and the admission avoidance service. Our partners in the Shropshire Community Health Trust will be undertaking a community services review, and it's imperative that this piece of work comes into the Shropshire Integrated Place Partnership. We've just touched on the Joint Strategic Needs Assessment and Community Rural Strategy, and a real strong focus on equality. Next slide, please, Daniel. So for the last few years, there's been a real shift in emphasis between treating people in hospitals and clinical settings to doing so in people's own homes or communities. In Shropshire, we are developing new models of accommodation to support people to live in communities and prevent hospital admissions in collaboration with our partners in housing, the NHS and voluntary organisations. The largest part of the mental health transformation programme will focus on the transformation of community mental health services to integrated working. And we have an agreed pathway of care which will enable collaborative delivery of support by many agencies in response to identified needs for the individuals. This will include a single front door. We know that COVID has had a huge impact on mental health, which is still being realised. In response, the health and social care system has prioritised the expansion of the Children and Young People's Crisis Service in 2021, ahead of that plan, and this service is now operational. Next slide, please, Daniel. Joint commissioning. A key priority for us is developing our collaborative commissioning opportunities, focusing again on place-based joint commissioning to drive efficiencies and system savings to improve quality outcomes for individuals. We have a new Assistant Director for Joint Commissioning, Laura Tyler, who commences her new post in September. This is a really exciting opportunity for Shropshire, and it aligns all of the all-age commissioning across Shropshire in terms of bringing together things like mental health, substance misuse, and adults and children. Health and Social Care Commissioners plan to review agreements and costs of specific contracts to look at options to re-tender and to contract differently with providers, in particular those individuals with high complex needs. There is also a plan to scope a shared live provider framework to deliver on specific health needs, specifically again for joint packages of care for people with complex needs. Next slide, please, Daniel. We have worked really closely with the provider market throughout this pandemic and recovery, fostering very strong relationships, enabling us to work closely with providers to develop new ways of working. Shropshire, Telford and Wrekin Local Authority, alongside the CCP, have developed a new process for commissioning care and supporting adults with a learning disability, autism or mental health needs. This process requires providers to respond to additional quality questions at point of tendering a scheme. This process was co-produced with parents, carers, advocacy services. It is more than double the number of providers in the market, which has increased the availability and variety of care on offer to people. We have redesigned our direct payments policy and relaunched that offer of direct payment as an alternative to commission care and support. This was done with Direct Payments Board and will enable us to increase the use of direct payments, providing greater flexibility of care and support with much better outcomes for individuals. It will also increase opportunities for small businesses and self-employed PAs, personal assistants, to grow. We have recently worked with Telford and Wrekin Council to procure a digital platform called CareCube. That will allow us to be more accurately assess the cost of complex care packages for adults with a learning disability. This again will enable us to provide more accurate data to providers when negotiating the cost of care and encouraging providers to review their pricing structures and business models. Last year, following consultation, a pilot project was implemented in terms of standard rates across our older adults care homes to work towards a fair, transparent and equitable market that can remain vibrant and stable. We have a Shropshire market position statement which needs to be reviewed. Our market position statement is a starting point for discussions between Shropshire Council and providers about how we can best work together to shape a diverse, flexible market of care that achieves the best possible outcomes for Shropshire residents in line with our key priorities. We want to see the creation of a vibrant and diverse community-based market of activities and services delivered by micro-enterprises, the voluntary and community groups and others across the county. And will welcome innovative ideas from the market, but generally increases the choice and flexibility that results in better outcomes for people. We are looking for other ways to work with provider organisations in creative ways to improve services, using outcomes and create great partnerships. We believe that a good relationship with the market will lead to good outcomes for individuals and efficient use of resources. We're currently delivering an assistive technology project into our supported living schemes, providing individuals with digital technology that will assist them to live more independently and reduce the need for formal care and support. We are working closely with care providers to introduce technology into schemes, and the next stage will be to look at how this can work in other care settings. We are also working with care providers to encourage them to diversify into outreach care and support, particularly in our more rural locations where we struggle to source care at times. Next slide, please, Daniel. This is in terms of housing and temporary accommodation. The council is short of temporary accommodation options and is having to utilise B&B placements across the county. This is wholly unsuitable for households who have been placed in such accommodation, as well as a financial cost to the council. The number of households presenting as homeless and therefore requiring accommodation is increasing year on year, meaning an alternative to temporary accommodation is needed urgently. We've set up a homelessness and temporary accommodation programme board, which is tasked with identifying alternative options. The need to reduce the council's rising costs on homelessness, temporary accommodation, and the need to find suitable solution for the council and its residents is now an urgent issue. Alongside more suitable temporary accommodation, we must work better at preventing homelessness. This means focusing on the reasons why people become homeless in Shropshire and working to resolve them as much as possible. The three main reasons for homelessness are a Section 21 notice through private rent, eviction by family and friends, and fleeing domestic violence. The work that we're currently undertaking, we're currently restructuring our housing services to ensure a better approach to our front door. Working with social housing providers to better understand housing need in the county and how we can better meet that need. We're reviewing the home point allocation policy to ensure that those in need of housing are those allocated accommodation. Improving our access to the private rented sector through better relationships with private landlords and a better utilisation of empty properties. Domestic abuse bill was sent on the 29th of April, providing further protections to the millions of people who experience domestic abuse. It also strengthens measures to tackle perpetrators. For the first time in history, there will be a wide-ranging legal definition of domestic abuse, which incorporates a range of abuse beyond physical violence, including emotional, cohesive and controlling behaviour and economic abuse. The aim of the bill is to raise awareness and understanding about impacts of domestic abuse, improve the effectiveness of the criminal justice system, strengthen the support for victims of abuse by statutory agencies. The new definition emphasises that domestic abuse is not just physical violence. New measures will include statutory definition of domestic abuse, a domestic abuse commissioner established in law, powers for dealing with domestic abuse, and statutory duties on local authorities in England to provide support to victims of domestic abuse and their children in relevant accommodation, appointment of domestic abuse local partnership board, publish a strategy and submit an annual report. So my final slide, members, is just a quick summary of those key areas in terms of what I've just highlighted in the previous presentation, which I hope you will find interesting and will consider for your future committee work programme. Thank you.
Yes, questions. Councillor Minery.
Yes, thank you, Chairman. Yes, Councillor David Minery for the record, for those listening. First of all, thank you very much, Tanya, for that. Really, really interesting. And obviously covering quite a long period of time. Am I right in thinking that this is in connection with the review of the corporate plan, and that this will be the main element within the corporate plan that applies to adult social care? And if so, what arrangements have you got in place, or will you be putting in place for monitoring and reporting back as to progress? Because you'll undoubtedly have targets and all that sort of thing. So,
thank you, Councillor Minery.
It's sort of a fluffy question. But
you're absolutely right. The corporate plan is due for review this year, and this programme of work will absolutely feature heavily within that corporate plan. What I've tried to do today is just to highlight those key areas of priority across the 3 service areas, which hopefully members will want to consider in terms of bringing in into programmes of work over the next 12 months into this committee.
Okay, Councillor Kidd.
Thank you, Tanya, and I've been on this committee for a long time, along with the chairman. So much of this I've understood and seen before, but actually for new members of the committee, there's a huge amount of information you put into that, and it needs some considerable unpacking. Will there be some training modules that go with each of those different areas? Because care cubes,
yes,
I mean, and that's relatively new to all of us.
That's very new to all of us, Councillor Kidd. And I was considering over the weekend that I'd be really happy to run some particular sessions for committee members in terms of these very big areas outside HOSC and Daniel. I think that'd be really helpful for us all, really, to spend some time, maybe an hour session on joint commissioning, for example, an hour session on the domestic abuse bill. So very happy to arrange that over the next few months.
And just to come back on that, if we've had that training, then when we come to, if we've built them already into the work programme, then actually we've already got a lot of the background before we get there, and therefore we can scrutinise much more effectively. And do you want to do something on that? Because I've got a couple of things.
Church, it's Daniel Webb here for the camera, microphone rather, overview scrutiny officer. One of the suggestions I've made to other committees, and I was going to put it to this committee as well, was that we, as well as meeting within the context of committee meetings such as this, is that we meet outside the meetings, as we do with the Joint Health Overview Scrutiny Committee. And those meetings can be a mixture of discussions around the work programme, discussions around items that you wish to scrutinise and how you might go about scrutinising that, and also, crucially, briefing sessions on some of the topics that are coming up in advance, so you're not getting the information sort of relatively fresh, and you have got time to sort of chew it over. So that's really is just to sort of support Tanya's suggestion there, and to sort of suggest that we hold regular informal meetings outside of the formal committee meetings.
I'm sorry to preempt you.
No.
It's really important to me that we do all of this. The other 2 issues that you brought up there that I think we're going to need to do, probably not just as us, are the rural care, the housing issues, essential workers in the countryside, and actually that's certainly us, but it's also other committees, and therefore are we going to be considering, Simon, for instance, some cross-working between other committees who will be looking at that? And the other thing is not just the policy around home point, it's the accessibility of home point to many people, especially the vulnerable, who may or may not have the support that they actually need. So there's work that needs to be done on the practicalities as well as the policy. And I would love, when we get to the work programme, to see some of that in there.
Councillor Huffer.
Thank you, Councillor for Ludlow East. Yeah, I think this is brilliant, Tanya. I think one of my key area that I'm really interested in is the mental health transformation, and that's something I think we really need to look at in depth. Currently, I know it's been lacking in getting referrals, getting diagnosis for for instance, autism. I know of some families been waiting 2 to 5 years and having to go privately and pay up to £3,000 to get a private referral to get that diagnosed and acknowledged. And CAMS, will we be looking at that? New referrals are still taking up to 12 months for a first referral, which is way too long. You'll be aware of all of this, Tanya, but I just think you need to look a little bit more in depth at this because it's brilliant, you know, transformation and commissioning of healthcare, but there's lots of things. I'm just hoping that those things will start to improve now, because at the moment they're significantly flawed, and it's taking far too long for families to get referrals.
Thank you.
David Noisy Health Watch.
Yeah, sorry, I've got
something
Gerald Aiken before was indicated before you. Okay.
Yeah. This covers an awful lot of things, isn't it? It covers basically all social services. The one I was particularly interested in one time was domestic abuse. Yeah, in that. Are they still as involved as they were?
But they are, Gerald, and they're part of that new partnership that I referred to earlier. They absolutely are.
Because
Very
it's
key part of that.
increased greatly over the last few months with lockdown and such, and I just wondered whether they do have put sufficient resources into it.
They're very much part of that strong partnership approach here in Shropshire. If I could just reference back to Councillor Huffer's comment, if I may.
Yes.
Chair. You're absolutely right. It's a very large area to discuss in terms of mental health transformation. I think we need to consider with committee services which element comes to this HOS, what comes to peoples, and what comes to communities, and what comes to joint, because there are many aspects of the mental health transformation programme that crosses over Shropshire at Telford and Wrekin, with one main mental health provider. So I think to ensure that we use our HOS well, we just need to box clever really in terms of which areas you want to discuss with the Shropshire HOS and which ones for joint.
I would absolutely echo that. It's generally been the Joint Health Open Scrutiny Committee that's looked at mental health, because the commissioning sits across the two local authority areas, and I think they share your profound concern, Tracy, around the inadequacies of the system as it stands at the moment, particularly the new commissioning arrangements which the CCG have failed to sort of give the Joint Health Scrutiny Committee confidence that those are robust going forward. Housing is an interesting one as well, because it does sit across several committees at the moment, in particular rough sleeping and all the support services that sit around that particular cohort of homeless people is currently looked at within the Communities Overview Committee. It's just, I think, because we have 5 fairly distinct committees, but we have a whole host of social priorities that bleed right across these sorts of areas. People with housing difficulties often have mental health difficulties, often have financial difficulties. So they have to sit somewhere. So sometimes not everything will come into this committee, but I'm always here to sort of explain when things are looking elsewhere, and I can also provide those links to other committees should you want them.
Okay, thank you. David, yeah.
Thank you. One comment and one request. Just as a matter of interest, Health Watch, unsurprisingly, have got near the top of their list, of course, mental health is one of their priorities for the coming year, which includes learning disability, autism, general mental well-being, and older adults' mental health, such as dementia. They've also got separately another priority for children and young people for physical and mental health. So obviously this is one of the great things for the future to look at. The request, I hadn't had time to digest all that. I'm one of the poor relatives. I haven't got a laptop. I've only got a PC at home. The slides, I'd be grateful if I could get a copy, because I'm sure my chief officer would like to see them as well. Thank you.
Yes.
Councillor Kate Halliday, I'd just like to welcome this new joint commissioning post, which I understand is joint funded between health and social care, and it sounds like a really interesting new development for us. There's been, I've sat in this committee for 2 years now, and there's ongoing frustrations between trying to develop services that are across both health and social care, and I think it's a really positive step, and I'm hoping that some of it may help with the mental health issues that a number of our members have raised. So I would really welcome some additional session on the commissioning of services, because I think that's going to be a very important area for us to move forward with. I think David from from Healthcare Watch has raised an important point, that elected members all have access to laptops, but actually members of the public may not. What is the council going to do to enable them to take a good part in these meetings, so that they don't have to print out papers, because we're going paperless, so that actually they can follow things on their computers? It's called inclusivity. Equality even.
I guess it's our first official meeting like this, Councillor Kidd, and we're learning. So I think
Precisely.
I think for the next meeting, I think it'd be good for us to perhaps share a presentation like this in advance if we can, so that members can follow it as a presenter is talking.
But if they can't, we've all got the agendas and everything on these computers. Actually puts an onus on people who've only got a desktop at home to buy a computer to come and do the same thing. So surely IT should be able to provide a laptop for those people who've been co-opted to the committee, so that they have an equal opportunity to us.
We can certainly take that away in terms of the consideration, can't we? And members of the public are invited around the table today. We've got two with us today. But as I said, we are learning in terms of how we run these kind of face-to-face meetings in a socially distanced manner. That's safe for us all.
That's my learning point for the committee.
Thank you, Councillor Kidd.
If I may, Chair.
Yeah.
I'm also, and this doesn't address directly your concerns, Heather, but in terms of sharing information, this week I've set up a Health and Adult Social Care Scrutiny Committee Teams forum, and the idea will be that I will drop a lot of this sort of information, papers, additional papers, presentations into that, so I'm not littering your inbox constantly with attachments and other bits of information. We'll be able to hold those discussions on that Teams group. You'll be able to access all of these sort of supporting papers on that Teams group as well. I'll send you invites to that in the next week or so.
Exciting. Thank you. Yeah. Any other questions? Yes,
I wonder whether, she had this point of view about people having computers who want to come to the meeting and not members of this committee. Is it possible we can use the library services for some of this, so that we can actually have copies of this in the library for those who want to go and see it?
It's certainly possible.
Yeah.
It's certainly cheaper than buying them.
No, I wasn't suggesting buying them.
Right. Okay. I think that's. Are there any other questions at all on Tanya's presentation? No. Right. Well, thank you, Tanya. Food for thought in a big way, but as discussed, certainly the training sessions on each of those items will be certainly well appreciated. Now, with a slight break from tradition, I just realised I never did item 2 on the agenda, disclosure of pecuniary interests. So I know it's getting towards the end, but are there any disclosure of any pecuniary interests?
I think I probably should be noted that one of the GP practice as part of the nursing team, just in case, a local GP practice in Ludlow session like surgery. I think it's always been noted, so it's an ongoing.
And, I think I got a pecuniary interest in the fact that I'm working on bank for the RJAH on the vaccination programme. So, any other interests to declare?
The only possible one I have is that my daughter is a high dependency nurse on outreach. She's an outreach sister at the Robert Jones and Agnes Hunt.
Okay. And David?
Yes, Chair, very, very tenuous, and it's not a direct one, but for the sake of clarity, I have a family member who is in receipt of domiciliary care.
Thank you. Getting back onto the agenda. Item 7, no, item 8 now, work programme. Report of the committee's work programme. Do you want to present this?
Okay. One of the sort of core, well, very much the sort of core of our work is contained within our work programme, which we produce for you in advance of every meeting. This is the work that you intend to carry out during the year ahead. The report will list the items that you've agreed to look at, what you hope to get out of those items, who you want to talk to, and what information you'd like to receive. The advantages of doing this twofold. First of all, it gives you the opportunity to think a little more critically about why you want to look at a particular topic, so we get better use of your time and officers' time. Secondly, as well, it allows us to order the work in a meaningful way, so you're not looking at topics too early or too late in the day, just the right time when you can have some influence over the development of them. And then finally, of course, it gives officers time to prepare work so they know what's coming. There's nothing more frustrating than a last-minute request for information from busy and overworked officers. It does happen sometimes, we understand that, but the more planning we can do now, the better use we can make of our time going ahead. I appreciate that's probably going to leave you a bit at the moment, because obviously we've got a whole topics and we need to put those into order, and that's perhaps not what we're going to achieve now, but I think we're a good place to start with, to asking ourselves, what do we think the priorities for the committee will be going forward that we can give to officers to enable them to try and timetable them to make best use of that time. I think that's all I've got to say. I'll leave it up to you, Chair.
Thank you. Right, we've got a list at Appendix 1 of item 8, topics that the committee have previously agreed to review. Really, I'm asking for comments, suggestions, proposals. Heather.
Certainly, as Tracy said, we need to go back to the mental health, because I think it's really important from our experience that for me, going to joint hospital, we're doing it in a lot of detail, have that local knowledge being fed through to us, or to me in particular, and Simon, because that doesn't come forward with just 3 of us there on the joint costs. So I think it's quite important, but it's the experience that we need, what's actually going on that we need to be able to feed in. But I also want the home points and the housing stuff built into this, because I think it's fundamentally important for the vulnerable. And I think we've all experienced a number of older people who have to move out of their rural areas actually to get the care they need, because either the accommodation is not there, or the care home is 20 miles away, or whatever, and that just means that we have all sorts of issues. So I think that's a big piece of work for us to look at, but I do think it's joint working with the other committees who are looking at it, because otherwise it's just us feeding in, and it's not balanced with everything else.
Mm-hmm.
I think housing allocations is, well, not so much the home point as such, but the housing allocations policy is currently under review of the Communities Overview Committee. They did quite a detailed piece of work around March this year, which reported back to Cabinet. So I would recommend you don't go into that sort of detail again, because that work's already continued.
It's worth us seeing it, because there may well be extra work around that, because some of that rural stuff is still there, and it's very difficult, and you mentioned that as one of your work streams, so it's actually important that we look at all of that and tweak if we need to.
Yeah. So if the committee agrees, yeah.
Okay. Yes.
Councillor Allcroft, Market Drayton East. Transport for outpatient services. Particularly concerned that some of the issues that have arisen since the COVID outbreak, getting people to hospital and to inoculation centres, in addition to outpatient services for kidney dialysis patients, there are certain definitions that need to be looked at, particularly the fact that most of those patients have to travel on their own and are currently being bunged in with the patients who could possibly cause infections which could lead to serious illness. So I think Transport for Services, and I know communities are looking at it as well in the rural community, but I think it's something we should be looking at to define who goes where and what type of services we're getting from the private ambulance services that are now running the patient outpatient services. Thank you.
If I may, Chair, I would strongly recommend a look at something around this area because it is a major area of weakness. The community, you're right, the Community Service Review Committee has looked at it, but really in the context of community transport and integrating public transport and community transport. I think where it hasn't looked any further is with regards to adult social care transport and also CCG Health Commissioned Transport Services. I know that they recently put this out to tender, and I think the contract is due to start again in October with regards to health services. So whether or not we can have any impact on that is doubtful, but nonetheless there remain considerable frustrations with passenger transport services that the CCG Commission, and I note with alarm that we quite often have seemingly vulnerable adults reliant on community transport services to access health services, so which committee may wish to take a further look at.
Just from the chair, have we had any input or sort of seen the details of clinical commissioning their new transport service?
No, they declined to provide it.
They declined to provide
They
it. Right. Can we?
Yes, we can, Chair.
Yes, right. Thank
I
you.
think alongside that, we've had passengers stuck on those buses for hours. And there's another issue alongside that, is that to get free transport, you have to be on benefits or whatever. I've got a number of people who cannot afford a taxi from my division to the Robert Jones, for instance, because it's 60, 70, 80 pounds, and yet they don't qualify. So it's a really difficult area, and we do need to look at that.
Yeah, I think that's definitely on the list. Yes.
In the future programme, is it possible to have a feedback now on where we are with the joint the hospital, 2 hospitals becoming one, Future Fit? I've heard nothing from Future Fit for quite some time now, and going back 2 years, it was almost on the verge of being sorted out.
Yeah.
And it seems to go back into the ether again. I wonder whether we could have a report back on that, where we are.
An update on.
Because I'd suggest that's probably a briefing.
A briefing, yeah.
I think that would be a good one with them, with briefing sessions that we've set up. Okay.
Yes, Kate.
I mean, this may be one more for the joint committee, but I was just wondering, you know, we're hopefully coming out of the pandemic now, but whether we could have something specific on that, and perhaps with a view to future planning. You know, hopefully we're coming out of COVID, perhaps a review of what's happened, but also, you know, what do we have in place for future events?
Got that.
That was built into the joint hospital, so they will be looking at it,
Yeah.
especially around those releases from hospital that, if you remember, I
Yes. Yeah.
and Kate was targeting.
Sorry, David and then Tracy.
Yes, thank you, Chair. I mean, I think all of these items listed are important, but for me, the 2 standouts are the bottom 2. Now, from what Tanya was saying earlier, I'm expecting that the commissioning will come back to us anyway at some point, because you're changing the arrangements and you will want to review these probably after 12 months. So I won't concentrate on that one at the moment, although it is really important. But the one that I think is essential is the final one on the list. As a school governor back in Market Drayton, who person who has to chair the exclusion meetings. It's quite noticeable over time, over the last 2 years probably, the number of cases coming before us where the young person has not had access to adequate mental health support, which is resulting in behaviours that are not acceptable and is damaging to the school. And the service is just not there. And so I'm not surprised that on investigation it was found to be inadequate. I would use much stronger language than that personally, but I won't here. So that for me needs to be one of the top priorities for us, is to find out exactly what is going wrong, what can be done to put it right, and indeed if there is a role for this authority under our public health umbrella to try and step in and do something about it, because it really is critical. And it's heartbreaking sometimes to see some of the cases that are coming before us for these young people, that if they'd had timely intervention could have been turned around.
Yeah, obviously the bottom one there is referring to mental health inpatient services as such, but you're obviously broader than just that,
Yes.
which is the joint.
Yeah, I think mental health, I would, because we are jointly commissioning Telford and Brecon, it strikes me as being the best place to consider that is within the Joint Health Scrutiny Committee. However, with regards to the inpatient services at SAT, there are, I don't know if anybody else ever read that report, it was quite shocking, some of the issues they found, and they were primarily around safeguarding and the inadequacy of safeguarding arrangements. In terms of this committee, we may wish to seek assurance that our council, a relatively minor council role with regards to safeguarding referrals are being met and acted upon appropriately, given that they weren't reported on within the hospital context or following significant delay.
Yeah, could I just come back on that, Chair, please? Yes, I totally accept that the broader issue is a joint one, but the last part of what I said is very specifically us, because what I'm saying is that if that is lacking, we should be looking internally within our public health structure to see what we can do as an authority, because we are letting people down. There's no doubt about that. And if the joint one won't pick it up, then we need to step in and do so. So that element is specifically for Shropshire Council, and I think is worthy of inclusion. But I absolutely accept the other points you made.
Can I just mention, this is obviously one of our priorities at Health Watch. So if any way we can help, because we're the voice of the people, we try to find out what people think of the services. If any way we can help, just get in to try Chief Executive Officer to see if we can help in any way.
Thank you.
Yeah. I think just to add to that, I mean, I'm a school governor, was a teacher, and actually the service hasn't improved at all. It may be a joint hospital issue, but actually this is about our schools, it's about our young people, it's about a system that is actually quite different to the Telford and Wrekin system, and quite often the joint find that something has been set up on a platform from Telford and Wrekin, which they think they can then implement in Shropshire, which just does not work, because we are so much more rural than they are, and to expect everyone to go to the chemist for something or this, that and the other, when actually our nearest chemist could be 18 miles away, is one of those areas that really concerns me. So I do think that although the joint hospital will deal with it, there's a specific area around all of this which is much more Shropshire. And my other issue is that Joint HOSC, and I know Joint HOSC are going to be working hard on this, but whenever we've called the health services to account, they come and tell us everything's fine and we've put things in place. And it patently hasn't been, actually. So sometimes it would be better that we are attacking it from several different directions, because our experience has been truly dreadful. And yet we have report after report that comes back to us to say, no, it wasn't. The training wasn't in place, this, that and the other.
I think I would concur with that to some extent as well, and certainly around how we commission these, not how we commission them, but the information that we use to commission these services. Our health partners will tell us they have a very rigorous sort of research methodology by which they base their commissioning, to which we have no involvement, it would seem. The cornerstone of this, of all of our health planning within Shropshire, is our joint strategic needs assessment, which Tanya mentioned earlier, which should be delivered by the Health and Wellbeing Board. Now, there is not a working joint strategic needs assessment, and there hasn't been for some years. And so this, given that senior officers say that this is the cornerstone of their strategic planning, this committee might be interested to find out why we don't have a joint strategic needs assessment and why the Health and Wellbeing Board has not delivered it.
That's added. Yes, Tracy.
Thank you, Chair. I don't think this needs to be on the work programme, but I would just like to request perhaps at some point we have a briefing, an update on social prescribing, because I know there's an awful lot going on in the community, and I'm particularly aware of it at our GP practice, and I'm a little lost on what's actually happening there, but I know there's an awful lot of work going on around that, but it'd be really useful to have a bit of a briefing update. Thank you.
Does our portfolio holder, does he have anything he wants to add?
Well, I look forward to working with the committee again, hopefully as successfully in the future as we have in the last 2 years. But specifically from my point of view, there is one area where I think that we can together add some value, and that is cross-border working with the Welsh health authorities. Because, as I'm sure, of course, Heather has these issues forefront of her mind in her community. We have these issues in the southwest of the county, cross-border with Montgomery and Welshpool. We have these issues in the northwest of the county, cross-border with Wrexham and Chirk, and it can be rather frustrating and difficult to get information out of our colleagues on the other side of the border. So I think it would be appreciated if scrutiny could take a look at that and perhaps suggest any ways that we haven't yet thought of or tried to increase the engagement with our Welsh colleagues.
Got that?
Yep.
Yep. I think Heather's quite supportive of that. I feel. Sorry, yeah, Tracy.
Sorry, just going to add to that. Can we also look a little bit more? I know my husband, whose area is Burford, Tembury, because he's got a significant problem at the moment. Well, it's not a problem, but Tembury Hospital GP practices are now going to be based in the Tembury Hospital. Well, we don't work at all with Burford and Tembury. That's obviously Shropshire. Tembury Hospital falls into Shropshire, but often residents look towards Worcestershire and that area. So I think, and it's a massive area, a division for. There's a lot of electorate in Burford around that area, Clean Hill, and I know we're not really up to speed with what is actually happening at all in that part of our council division. I'm just asking perhaps we could do a little brief request. I know you'd be interested because it was a question I was going to put to Health Scrutiny, what's happening with Tembury Hospital, and I'm just wondering if we could find out a little bit of information about that GP practices amalgamating in Tembury. Thank you.
Right. Well, I think that's quite a good grounding.
One thing, actually, Chair, that I didn't put on this report is that the committee did agree last year that it would look at commissioning arrangements in Whitchurch as well, particularly in the light of the closure of one of the GP surgeries there and the failure to find service providers to deliver that. So just mentioning that, perhaps a broader topic around practice provision throughout the county. I'm just throwing this as an idea here, whether or not you want to look at it more specifically or generally.
I think probably it is an issue that isn't just just in the Tembury area. Right. Well, on that note, can I thank everybody for attending the meeting? I'll draw it to a close. I just say, you know, as chair, I look forward to working with you all, and particularly working on the joint task with Kate and Heather. Yeah. Fine. Thank you. Oh, did you want? Was there anything you wanted to say?
No,
Sorry,
you're the chair.
I'm sorry, I cut you off. Okay. Thank you all very much.
Thank you.